Peds Patrol here, double board certified pediatrician, and today we're going to be talking about childhood mental health disorders. And to help us, we're going to take a look at this handy dandy chart. So just like adults, mental health is a spectrum in children ranging from toddlers, infants, and teenagers as well. Many times as pediatricians, we'll get referrals to assess a child for a mental health issue, mostly ADHD. But ADHD can look like many different things, and they may not categorically actually have ADHD. Hopefully this video will show you the different types of mental health conditions in children, some of their key features, and how to identify them, so when you talk to your healthcare provider, we can provide the appropriate resources and management to help your child. I kind of like to think of behavior as a big circle in the sense that it's a Venn diagram of many symptoms that can be categorized into groups of things, but also they can bleed into each other. Sometimes one child may just have one specific condition, but another child may have many multiple conditions at the same time, and it takes your healthcare provider many assessments, sometimes many playtime sessions, many videos, many observations, and a lot of questionnaires to tease out what's really happening so we can best have a management plan for your child. So let's start off with the first one, ADHD. So you know this is very common. If a child is very hyperactive, very impulsive, cannot sit still in class, loses focus very easily, can sometimes have some temper tantrums and some issues with authority, they may have ADHD. Sometimes you may see a kid that's a little bit shy or maybe a little bit more anxious, scared a lot, a heightened flight or fright response. That can look like anxiety. Obsessive compulsive disorder is children who have these feelings of innate wanting to do something, whether they want to wash their hands or flick the light switch back and forth or close the door to make sure that it's really, really tightly shut. Those are children who have obsessions and compulsions. Tics or Tourette's can look like motor or vocalizations that look like maybe constant eye blinking that maybe looks like a seizure, or they may have coughing, but there's no runny nose, no fever, really nothing to show that there's a signs of an infection. They may sometimes have abnormal movements that can also look like a problem with their tone. However, they're distractible, which is the most important thing. ODD or oppositional defiant disorder, these are children who do not like authority whatsoever. They will lie, they will have severe temper tantrums, they will not listen to you, either if you're a parent or a teacher or a babysitter. They just don't like authority. They're like, parents don't understand, so they'll act up. Conduct disorder or antisocial personality disorder is also on the spectrum of ODD. These are children who may be pathological liars. They may set things on fire. They may hurt animals. They really don't care about consequences, and that can lead to having antisocial issues when they're older than 18. I also put depression all the way in the corner because that can also affect children and can also be signs of anxiety or signs of ADHD. Kids who are not focusing in class because they're sad or they're having really intrusive thoughts. Sometimes they don't talk a lot. That can also be sometimes the symptoms of the spectrum. Finally, the big one over here, ASD, as you know, autism spectrum disorder. Because it is a condition that affects the brain and growth and development of many children, it's very hard to tease out other conditions that they may be happening, but it's also on the spectrum as well, and it requires specific criteria to be met, like social communication skills, and typical movements and restrictive behaviors, but that can also have comorbidity. So you can have a child with autism, but also with ADHD, a child with autism, also with anxiety. Now, a lot of you may ask, well, what's the point of labeling my child? It's really unfair and stigmatizing to label my child. It can also lead to a feeling of unworthiness. It can also lead to a feeling of further anxiety in the family, and it can also lead to bullying in school. But really the point of the label is, one, to identify what you have, two, to provide you with resources to tackle them, and three, to open up some financial or potentially other supports that are available in the community to help you deal with those issues for school, for programming, and for medication purposes. And as you can see, it's a circle and it's a Venn diagram of things, which means that sometimes you can be in one area a little bit more at times or another area at other times, and you can outgrow some things. Some of these things can change through time as you grow and develop naturally, and sometimes things can get worse. So it's really important to really get an idea of where you are, where you fit in the spectrum, and how we can help you guys as healthcare providers. You may also see that sometimes many family members may share very similar symptoms and experiences as well. So if you have a child who is anxious, you may have parents who also have underlying anxiety as well. The same thing with ADHD or autism. Sometimes these things run in the family, and sometimes they may be passed on, but in different kind of variations. So if you have a parent who may have ADHD, your child may have more of an anxiety subtype. Or if your parent has ODD, they may be more inclined to have tics. So there's also familial inheritance to these as well. So just because you have one doesn't necessarily mean you have the same one, especially in your child. You may have sort of symptoms that may be in the spectrum. The most important thing as a parent or a healthcare provider or a teacher or a babysitter is that all of these symptoms look very different in children, and it also depends on their developmental age and stage as well. So depression doesn't look like somebody who may be sad and pouty all the time. They may look like a child who's very, very shy, who doesn't want to speak, who gets hurt very easily with just regular comments. Something like oppositional defiant disorder may look like not paying attention in class because they don't want to listen to what the teacher has to say. Tics can sometimes even look like seizures and you don't really know. And so that can be quite significant because the treatment for seizures is completely different than the treatment for tics. Sometimes conduct disorder can just look like regular teenager behavior. Teenagers lie and steal all the time, but there is quite a bit of a difference in terms of what diagnostically conduct disorder and antisocial personality disorder is. Someone who likes sports all the time and plays different sports in different positions can also look like somebody who has ADHD, but it doesn't necessarily mean that they actually have it. And everyone knows that autism is on a spectrum, which means you can have a child with significant global developmental delay, but you can also have a child who's really, really good in math and in English and can problem solve really, really well, but they still don't have the basic social communication skills and the deficits there, and that's why they have autism. So what does it mean for you as a parent or a provider? What do you do when you need to figure all of this stuff out? So talk to your family doctor, talk to your pediatrician, talk to your psychologist, talk to a therapist, talk to so many people who are able to potentially screen these things and identify these things. And like I mentioned before, you may need to fill out a questionnaire. You may need to take some videos of your child. You may need to have multiple visits with a healthcare provider to figure out what really is happening and how we can best provide you. Sometimes these things can be exacerbated by social situations like lower socioeconomic status, financial issues, food insecurity, adverse childhood experiences, trauma, witnessing intimate partner violence, domestic abuse. And you can see some of these go up and some of these go down. And so it's really, really important to stay in constant communication with your healthcare provider to identify those issues so then we can target these therapies accordingly. And guess what? Not all treatment is drugs. We don't always push pills. A lot of these symptoms can be managed with therapy, with talk therapy, communication skills, parent skills training, parent behavioral therapy, cognitive behavioral therapy, and so many more other options that are available that are not specifically just meant for medication. However, if symptoms are very pervasive and let's say a child is a flight risk, maybe they're running away, maybe they're hurting themselves, maybe they're hurting other people, then at that time there's a conversation to start medication. And medication is usually started at a very, very low dose, and your healthcare provider will talk to you about symptoms, side effects, and when a medication needs to be reassessed to be stopped. The nice thing about using questionnaires and tools is that as the year progresses, you can always reassess and things if symptoms are improving. And you can use these tools to determine if medications need to be weaned or strengthened or increased, and then go from there. As always, keep your communication lines open with your healthcare provider. Talk to them. Talk about if you're worried about anything. We can screen for these things very early on, as early as even 6 to 12 months of age. So it's very, very important to keep and coming to your daily well visits as well as your follow-ups just to make sure that we screen for these things. It's very, very important because at the end of the day, we want to do the best by you and beside you and make sure that your child grow healthy and happy. As always, follow for more for really great tips and techniques, and I'll see you next time.